So summertime is here, and along with the nice weather come mosquitoes. And unfortunately, mosquitoes can transmit West Nile virus, which can make us quite sick, so we want to take a minute to think about it. West Nile virus is an infection transmitted by mosquitoes. It tends to peak in the summer and the early fall. Most people who get West Nile virus actually have no symptoms. A quarter of people who get it can have fevers, headaches, muscle aches. But the reason we really get worried about it is because a small percentage of people, about 1 in every 200 infected, can have neuroinvasive disease, meaning they can end up with an infection of the brain called encephalitis, or the fluid around the brain called meningitis. And that can lead to long-term severe problems and even death. Although we want to be careful about West Nile virus, it is very rare. On Long Island, only about a dozen people or so are diagnosed with it every year. And again, among people who do get infected, only about 1 in 200 are going to go on to have severe disease. That said, we want to be careful to make sure that we can avoid getting it at all. The best way to avoid getting West Nile virus is to stay away from the mosquitoes. Of course, that's going to be hard to do. We're all going to have some mosquito bites from time to time, so you don't want to be too alarmed about it. But what you can do is when you go outside, you want to take any water that's sitting around your house, any stagnant water, and dump it on the ground because that's where the mosquitoes lay their eggs. You also want to check the windows in your house to make sure that the screens don't have any holes, because if they do, the mosquitoes can sneak inside and start biting. When you do go outside, you want to avoid any areas where there are lots of mosquitoes. The mosquitoes like to bite early in the morning around sunrise and also around sunset. And then, of course, you want to cover up with long sleeves and long pants if you're going to be in any areas with lots of mosquitoes, and use mosquito repellent anytime that you're going to be in those areas. The vast majority of the time that we get bitten by mosquitoes, it won't cause much of a problem aside from some itching. Of course, during the summer, if you start to have fevers or headaches, or you feel like someone in your family has fevers and isn't acting quite right, you want to speak to a doctor and consider having them evaluated for West Nile disease.